multiple system atrophy subjects can be so difficult to identify and to distinguish from those with Parkinson's disease. What we wanted to do was really enrich our population for subjects that had multiple system atrophy. And what we employed in part was a recently developed diagnostic tool looking at different types of alpha-synuclein aggregation in subjects with MSA versus Parkinson's. And we did a rich analysis where we combined that at baseline with their activities of daily living like scores, as well as evidence of atrophy or brain iron increases by MRI. Our main finding was that when we looked at subjects that were enrolled because they had probable MSA and they had elevated plasma NFL and they had elevated basal ganglia iron, when we looked at their MRIs at baseline, 96% clearly had atrophy and brain iron that made that a consistent diagnosis with MSA. When we looked at the alpha-synuclein aggregation assay, it wasn't quite as consistent. 60 of the 76 subjects were MSA, and their imaging looked just like MSA, but 11 came up as PD, which was a surprise to us. That was a repeated result, and 9 of those 11 had MRI evidence of MSA. They had a lot of atrophy, which you can see here, and elevated iron in a way that just wouldn't really be consistent with Parkinson's. We also had another 5 that didn't have any evidence of alpha-synuclein aggregation. 3 of those, it was great to have that paired with the MRIs because, as you can see here, there's really no evidence of atrophy or age-inappropriate iron elevation. But 2 of them still had really significant atrophy that would be consistent with MSA, despite not having any alpha-synuclein aggregation in the CSF. It's great to just take a multimodal approach. None of these individual things might stand up on their own. What we did see is a really strong connection between the MSA diagnosis by the MRI and how the subjects were enrolled. But it was really nice that if we had negative MRI findings, that we could back that up with the alpha-synuclein. And vice versa, it was nice if we had PD findings that we could say, well, let's check that out with MRI. At this point, we think that a multimodal approach is really one of the best ways to ensure an enriched population is being studied.